Ellen, first up on the agenda is just a more formal introduction
Yes.
of James to the board and the audience.
Yes, James Stevens, who is present electronically today, is the new, one of our two new appointees to the Health Board, the Air Pollution Control Board, and the Water Quality District Board, having been appointed by the county commissioners in December. He is CEO, president, and I think some other titles. James, I'll leave you a minute of Blue Marble in town. He has an extensive, I would say both wide and deep, in some areas, scientific background, and also has some background in different aspects of public health work, both here but largely overseas, that are very, very interesting, including specifically China. We're very pleased to have him on the board. We've only had, he and I, one meeting to do a little orientation. And we've already introduced you one by one to the the 4 board members plus you that are present, which constitutes our quorum. So I'll ask Debbie to welcome, and then we'd like to hear a little bit from you, Mr. Stevens.
Yeah, so James, welcome. And,
No problem.
And thanks for your interest, and to the county as well for the appointment to the health board. And I'll just give you a minute to introduce yourself and talk a little bit about what you do.
Were you able to hear Debbie?
Uh-oh, did we lose him?
Oh, no, don't tell me we lost him. James?
Yes,
It appears you weren't able to hear Debbie. Our chairman, would you try again? So,
Sure, James, I just was saying welcome to the board, and thanks to the county for the appointment, and looking forward to working with you. And I just wanted to give you a minute to just tell us a little bit more about yourself and your interest in the boards.
well, yes, thank you very much. Thank you guys for the appointment to the board. I'm looking forward to serving with all the rest of you. Just to give you guys a quick background on myself, I am the president and CEO of Blue Marble in town. I used to be the chief scientific officer and the co-CEO, but I inherited kind of all the roles before. From a technical background, just so everybody knows, I'm both a microbiologist and a chemical engineer in training, so I kind of have a broad range, and I've worked in everything from pharmaceuticals and doing STD diagnostic development overseas to environmental remediation and using microbiology to clean up contaminated sites. And most days now what I do is I work on a combination of flavor and fragrance and food safety problems for major multinational corporations around the world. So that's a quick briefing. If we need to do more, let me know.
No, that's perfect. We're looking forward to your contributions on these boards. So welcome.
Thank you.
Moving on to the agenda, I don't think we have minutes for the Board of Health, so number 2 will be deferred. Number 3 is action on staff recommendations to the City Council for revisions to the Environmental Tobacco Smoke Ordinance.
Okay,
We have
so-
a presentation?
we do,
Yes.
and I'll just introduce that. What the staff is bringing to you today is actually long been in the works for over a couple years, and it has to do with revising and updating the City Council's smoking ordinance or environmental tobacco ordinance, which is still in existence, having been adopted in 1999. So Missoula was the first local community to do this. That ordinance that's still in existence was extended using the extraterritorial powers statute to a 5-mile zone outside of the city. So the city adopts it, and then in order to make that extension effective, both the health board and the county commissioners have to agree to that. What we're asking of you as a board today is not to adopt an ordinance. I want to be really clear that what we're asking of you today is to adopt a resolution that sets forth a little bit of the history you're just about to hear. And much more specifically, in the now therefore be it resolved part of the resolution, talks about the key aspects of the ordinance that we as staff recommend that the board resolve and send forward to the city council and to the county commissioners. So your formal action is about that resolution and that resolution only. You do have the most, I would say the second most recent iteration of what that ordinance at the staff level of preparation is looking like at this time. So on one hand, I want to say the staff, and that includes county attorneys, city attorneys, chief of police, city parks, we are setting up with county parks, environmental health, health promotion, and so, I mean, a lot of staff work in the last 2 years to get it a draft to this point. We are not asking you to adopt that ordinance today. I always want to be really clear for members of the public as well. But what we wanted to do was give you what is our best thinking from the staff level at this time, so that when you read this ordinance, you can get a sense of how that might look. And also we want to, when it does get referred to city council, which assuming you accept our resolution, amended or as is, that the formal process is starting with the best staff thinking. And this also then provides the health department, the health board, a first opportunity to give us some input. It doesn't have to be nitty-gritty input, but we've got pen, we're ready to take it, on how you think this is looking or what your questions are. There will be other opportunities to do that before we would get all the way to the end of the process, whereby we would be asking this board to adopt the ordinance for extraterritorial application. So this is our first formal step.
Jean, question?
So just to further clarify, the ordinance itself, we're making recommendations, staff's making recommendations. The ordinance gets adopted by the city council.
It does. But in the end,
Comes back.
you couldn't extend it without them adopting it in the first place. So our staff's job, just as we've worked, and I really want to credit these two individuals you're looking at, picking this up from where basically I left it a year and a half ago and getting it to the point that it is. They have made more changes since the time we put this in your packet, and they will make more changes, but some of those may include yours. Because so they will continue to keep working through both the staff and the 3 elected and appointed bodies and the 20-some individuals whose eyes and authority exist in putting the end product in place. And in fact, when we wrote the resolution, if you studied it carefully, we had already made a change in the ordinance that reads a little differently than we wrote the memo that came early in your packet. But the purpose of the resolution was to also communicate between all of the parties, be it the public, the city council, the county commissioners, the different attorneys, what your intent was, what it is you're recommending. So we've all met, we've done heads-up meetings with the key city council representatives yesterday and county commissioners as well. Okay. So now I think it's Kayla's.
So,
Or Shannon, excuse me.
Hi, Shannon Terrio. I think you know how to spell my name. I'm just gonna, Kayla is sort of gonna start, but just to put a frame on what we're doing, there are certain things that we are asking or that we're trying to accomplish in the proposed changes, and that's really the key part, or one of the 2 key parts in the resolution. And that is to delete or amend provisions that are less stringent than state law. State law came in, the Montana Clean Indoor Air Act came in and prohibited smoking in most enclosed public spaces. in 2005, and then extended that to bars and casinos and taverns in 2009. And when that happened, the Missoula ordinance was less stringent than the state. So we sort of set it aside and just didn't think about it very much anymore. Wanted to clean it up eventually, and decided that we actually talked about, should we just abandon it and just rely on the Montana Clean Indoor Air Act? And in having that conversation, we decided that there were some things that would be good to codify. And one of those things is our smoking shelter requirements. And I will talk about in a little bit how we do that within the proposed language. And then also to add vaping to the definition of smoking, which would also add it then to the prohibition of being able to do that in enclosed public spaces or in indoor public places. And Kayla will give us some more information on that. And then to prohibit smoking, this also codifies the city parks, at the request of Donna Gockler, the city parks policy about not smoking near where children are playing. And so the ordinance would prohibit smoking in certain outdoor spaces. And then it would provide an opportunity, because we have heard from managers, especially of downtown businesses, that they don't want people smoking right outside their doors and the smoke is coming inside. But they really couldn't find any ability to restrict, like the city and the county have been able to put up signs to say smoke 25 feet away from our doors, but they're not finding, it's like, where's their authority to do that? And so this would give people the opportunity to restrict smoking in other outdoor public spaces, and we'll talk about that a little bit more. And then a big one has been to clarify enforcement procedures and penalties, which I'll get into in a little more detail. Now I'm going to turn it over to
Thank you
Kayla.
for singing my part. I think I was supposed to say that.
That's all right. Hi, so my name is Kayla Warren, and I'm the Tobacco Prevention Coordinator here in the county, the Health Department. And when we started this with Ellen about 1.5 years ago, e-cigarettes weren't necessarily on the table. And I've really pushed to try and get them into our ordinance, primarily because they're such a growing trend. We see them, basically vaping in public places is considered normal nowadays. And because of that, rates are going up. We see that especially with youth, which is really kind of scary. Our youth rates here in Montana, about 50% of all high school Montanans have tried e-cigarettes, and 30 are considered current e-cigarette users. So those are huge numbers, especially considering all the strides we've taken in tobacco control prevention methods, and smoking rates are down, but e-cigarette rates are up. So we just thought that this would really fit well in this ordinance. Another piece is this would help reduce the exposure to secondhand vape. We're seeing that that's becoming more of an issue, especially indoors. The CDC even says that some vape includes heavy metals like tin and lead, so kind of reducing that exposure. And then the big piece is just this August, the FDA ruled that e-cigarettes are now considered a tobacco product and can be deemed as such, which is kind of neat for us because now there's age restrictions on them. There's going to be carrying warning labels. So we're seeing this progression towards some type of regulations with e-cigarettes, so we thought this would be a good fit. As for tobacco-free parks, next slide.
This side.
Oh, tobacco-free parks. When Donna kind of came up and asked if we could move forward with this, we were really excited. Again, it promotes a healthy lifestyle, which, as we all know in Missoula, that's kind of our key. We like to have healthy and happy lifestyles here. Protect against secondhand smoke exposure, no safe level still according to the CDC, so this would help. Keep our lands clean. E-cigarette and butts are the #1 waste that they find in parks, so reducing that is huge. And then finally, especially after this last year, we look at reduced fire risks, and that's not only indoors but outdoors as well. So kind of, again, the need for including tobacco-free parks.
So I'm just going to take you through, really there are 4 major changes, and tell you where we find them instead of going line by line through through the proposed ordinance at this point. The first is, of course, the change that we've been talking about is adding vaping. We've added it to the definition of smoke and to smoking. In fact, just this morning, Kayla and I talked about how to make it more clear in the definition of smoking. By doing that, it means that it's included in the prohibitions of smoking indoors. So you can't use e-cigarettes and vape in enclosed public spaces or indoor public places. We also added language to the purpose section to explain why that was important, similar to what Kayla was just talking about. And then the second major thing, the second goal here is to expand the smoking prohibitions. As I talked about, indoor, really it stays the same as the Montana Clean Indoor Air Act, except that it includes vaping. But it includes the public parks, and you have a list of specifically those public spaces that are where smoking would be restricted. And then it provides the opportunity for people who are in charge of public spaces to sign their property, no smoking, and then it would be a violation of the ordinance to smoke there. So that is, those are the expanded smoking prohibitions. Then in 2010, Missoula needed to provide some guidance. I know that's a crazy picture, isn't it? I think it's snow, I don't know. Needed to provide some guidance on smoking shelters because a lot of people were building smoking shelters then. And we came up with a policy in 2010 because there just was not a lot of language in the Montana Clean Indoor Air Act to do that. So we would like, it'll be easier for the public to find it if it's codified in the municipal code. It would still apply to all parts of the county because it's a policy that we have been using since 2010. And there was a court case about a smoking shelter in Cascade County, which really validated our interpretation of the Montana Clean Indoor Air Act and our smoking shelter policy not too long ago. And then probably the reason why we aren't giving you a copy to say, hey, pass this on to the city council is the enforcement piece. This has by far been the hardest piece to really figure out. We have to be realistic with our ability as a health department staff and how much enforcement and compliance seeking we can do. This makes it clear that for the indoor violations, it is the health department's responsibility for education and enforcement and compelling compliance. And at the recommendation of, I think Michelle Kerr is on the city council, it also says let's use the same procedure as the Montana Clean Indoor Air Act for both the process and the fines. What that means is that an indoor, if there is smoking or allowed smoking or not the proper signage in an enclosed indoor space, we would first give a warning and then a reprimand before fines would be considered. So, and then the fines go up as the number of violations go up. So that's been established in the Montana Clean Indoor Air Act. And we've tried to make this rule as consistent with the Montana Clean Indoor Air Act as possible. Then when it comes to outdoor violations, really it is the managing entity of that space who has to take responsibility. So if, and for instance, Parks is very willing to do this. They know that they want their parks to be smoke-free in those specific cases that they have listed, and that park staff will need to tell people who are smoking to stop smoking and to move beyond the 25 feet if that's appropriate. But that's going to be true downtown, well, for any business as well. If they say that they want to put up signs and not allow smoking within 25 feet of a doorway or an air intake or another entryway, they need to be responsible for going out and telling people that they can't smoke there. That is their job. That's not uncommon. That is true in other smoking ordinances in the country. So that's something that has been worked out. But still, it would be a violation of the ordinance to smoke there. And so while it is their job to get people to move out, if that is just not possible, then the police could be called by that managing entity, and it's possible that they could be fined for smoking in a place that they weren't supposed to. It's possible the police will just give them a warning. So the Montana Clean Indoor Air Act process does not apply to outdoor violations. That would be harder to manage, and that only applies to the indoor violations. It was really important to the city police chief that people don't have the expectation that somebody driving down the road would see somebody smoking within 25 feet of a doorway and call 911 to respond. And so that's why we've worked really hard on the language, and why the language is still being modified in order to try to make that as clear as possible. And then the extraterritorial application of this ordinance, the possibility of that also makes it some of the enforcement, it brings up enforcement questions. So the mayor, based on state law, has the ability to enforce this extraterritorial with the approval of the commissioners and the health board. And what does that mean for where police would respond if they needed to, or the sheriff's department would respond? And it's been a super interesting issue to try to figure out, and we're still doing that. But that's where a lot of the continued language changes are coming from. So the resolution, in addition to the first slide that says this is what we are trying to accomplish, also has a second resolution that you are encouraging the city council to adopt an ordinance, and once that happens, that the Missoula City County Board of Health recommends to the commissioners and the Missoula mayor join the health board in acting to apply the ordinance to the 5-mile zone outside the city limits, to provide the same public health protections and the same opportunities for businesses to restrict smoking within 25 feet of their doorways or windows or air intakes. And I will just say that this is different from the memo that you got, and it's because we've just been understanding the process. We've been getting more and more clear about the process as we've been going, and some of that happened just in the last week. And so the proposed motion is different than what you have in your memo, and the health department is requesting that the board adopt the resolution recommending revisions to the Missoula smoking ordinance.
And I recognize that I'm being maybe overly emphatic, but this may be the first time that some members of the public hear about this inherently complex process. The board's being asked to adopt the resolution and refer the resolution. The board is not being asked to adopt whatever version or to refer a specific version to City Council. Staff will do that. So what you see in front of you is, unfortunately, because we work fast and never quit working, and maybe 2 iterations behind, just based on, we put this in your packet, I believe, on Thursday. Okay, thank you.
Just for my clarification, the 8.37 is 2 versions behind where you currently are.
What's the date on that?
111.
Yeah.
Yeah, it's we have a version that's 117 and a version that's not written yet, and it has to do with meetings that we've continued to have with the city and the county attorney's offices and the city council. So city council members yesterday, and it really all focuses on, I can't think of a change that doesn't focus on enforcement except for definitions. Definitions.
We want to make sure that we don't lose any, much of what we did in 1999 was good at the time, but there are parts here that, we want to make sure we don't throw out some of the history that's still useful. The point at which the draft becomes the draft for formal purposes is when it gets officially referred, which will not be before February 1st. The chairman of the Public Safety and Health Committee that we met with yesterday, and Julie was present for that, would accept that referral after February 1st and put that into their formal process. So while this is available, it is not the formal referred
Yeah, I would say with a
ordinance.
good amount of certainty, there's not going to be any substantive changes.
Yeah.
There were just a few language changes regarding enforcement. It was in deference to the departments that are able to enforce, which are only a couple, is the police, the health department. I mean, there's only so many remedies that you have between infraction citations and revocation of licensure that are able to actually enforce it. So that they wanted a language change, just saying that multiple city departments have the ability to identify noncompliance and refer them to the appropriate agency for enforcement. And that was really the gist of the change that they wanted. Other than that, they didn't have issues with
Mhm.
fines or fees or how it's written and what it references. So I don't think there's going to be a lot of changes.
Now, Anna Conley has been working with staff throughout this time and keeping Matt apprised, or we hope keeping Matt apprised, and he's also, but I wanted to provide an opportunity if you have anything to add before questions.
I don't think so.
Thank you.
I would move to adopt the resolution of the board to the city council with whatever revisions are coming down the pipe, but I don't think they're going to be a lot different.
Okay, we have a motion on the floor.
I have just one question.
Yeah.
I'm fully supportive as well, and especially the inclusion of e-cigarettes. I'm wondering, since we're first people doing this, and I don't think e-cigarettes are in the state Clean Indoor Air Act, are we setting ourselves up for kind of some legal controversy with the state if we adopt this ordinance?
Actually, we're a little behind the curve.
In reality, there's 7 other counties that have went countywide in Montana with e-cigarette inclusion. So we're not super far behind, but we're not ahead of the curve by all means.
Okay.
And these have went, and this hasn't been recent, these have been in the last 2 years as well. So it's becoming more and more common. I have a list of the counties if you'd like to
Yeah.
hear them.
Some of them, yeah, give them.
Yes, so there's Sanders, Granite, Powell, Webo, Lewis and Clark, Carbon, and Yellowstone.
But statewide, state indoor air act, not
No.
yet.
Does not.
But there's nothing in the state Indoor Air Act that prohibits more stringent.
It does not preempt
Okay.
us in that, no.
Okay.
I would think the other thing that is with the CDC, was it CDC that added in August?
FDA.
FDA added added it to the tobacco list. I think that gives us more of a leg too.
Well, it gives us the age restriction by adding it to that
True.
list. Which I know Dr. Stinger would like to see 21 as opposed to 18.
I would very much like to see 21 as opposed to.
Or 75.
Right.
We have a motion on the floor. Do we have any public comments on the motion on the floor? Any other board or staff comments on the motion? Okay, all those in favor signal with aye.
Aye.
All those opposed?
Thanks, James.
James votes
Aye. Great.
I just say aye, this is good.
Thank you, Shannon.
Thank you very much.
Moving to agenda item number 4, adopt a resolution on targeted case management for high-risk pregnant women, children, and youth with special needs.
Okay.
Ellen?
This is a late added agenda item. It was added 2 days ago. I did get, in consultation with the county attorney, in this case Anna Conley, make sure that adding the agenda item 2 days ago was appropriate for you to act on it. The news that came to us 2 days ago is what prompted us to use this opportunity of you meeting to add the board's voice to the continuing concerns about budget cuts and from the state level. And in particular, for this department, everyone's experiencing them. This is not just this department whining, but in particular, the targeted case management for women, infants, and children, which is a very, very preventive service and is a long-standing service that this community has relied on this department providing for about 30 years. So as you can see, this resolution is a little longer. That's usually a sign of having less time to edit. The purpose of this resolution, though, is not anywhere near as specific as the purpose of the one you just passed on the smoking ordinance. This is truly to add the health board's voice to any internal face-to-face informal media and formal hearings. There's one coming up that deals with targeted case management. And I would like to have the board's voice. I didn't put anything in here to speak about the evolving rule changes. I did ask Anna Conley, who's been looking at what remedies or formal actions we may have to take at the appropriate time if things don't work out better than they appear to be. This is not about those specific actions. This is about the general concern and what we would like to see in the now therefore be it resolved section, the end product to be. The product, the outcome right now, as you know from our last meetings, was TCM was going to be cut completely for high-risk children. That did not happen. They reduced it by what looks to be about a 20% of our revenue. That revenue for us is it's about $200,000 a year of ongoing revenue. It's taken a lot of the system to build that. I won't go into all of the whereases, but the whereas are trying to say this is what you're taking apart. It's more than money. It's more than counts of kids and women. It is an absolutely integral form of prevention across the country for the developing fetus, the developing child. It is the most primary form of prevention that you can offer in a population setting aside from clean water, clean air. So immunizations, and I know I'm speaking to the choir here, but this is more than a cut. This is a removal, a very counterproductive removal in a situation, a removal of resources in a situation where we're already losing resources because we will have higher costs in our healthcare systems. We will have higher societal costs, and this is where I get it may sound a little self-serving, but we are not the most important agency in the community, but we are the public health agency, and everyone refers to us for these kids. It could be you, it could be your neighbor. It's very often the child welfare system, the state itself. It's very often Child Protective Services. We have formal referral agreements with Partnership Health Center, with Community Medical Center, with Missoula County Public Schools. The changes that are being made erect insurmountable barriers for us to provide this service as a Medicaid provider. Those are the original changes. The changes that were proposed without any warning to us, in spite of a written commitment from DPHHS after we protested the first changes of the rule, no health officer, nor did our professional organization get any heads up about the changes that prompted us to take advantage of meeting with you today. Those came on Tuesday. They leave all those barriers in place, which would make it so that the majority of the kids we serve would not be eligible. So if we refer someone to PHC, that's it. They refer them to us, they can't be in both places. It makes no sense. Adding to that on Tuesday then, is they're proposing now, so this is a proposed rule, and there'll be a hearing on February 1st, at which I would hope to use your resulting ordinance. They redefined the kids that are eligible for this service. Let me give you an example of the wording. A child that is believed that is either paralyzed or paraplegic, who is on a respirator, who has a heart disease or chronic condition expected to last at least 12 months, which by definition, chronic diseases tend to last longer. Newborns generally don't arrive with chronic diseases. So there is one workaround if you've got a kid that doesn't have any of those really, really terrible health situations, but they have a chronic disease and they're having trouble with the healthcare system and the social system, we can see them. But newborns don't come with chronic diseases. They may come with a genetic problem. They might come with a cleft lip and palate. The nurses need to be with those folks right away. I'm going to give you an example of, this is a composite example so that it doesn't reveal anyone's identity. The situation has gotten worse to where all the places that have already lost case management for those that have already developed behavioral problems or have developmental delays and other long-standing and in fact incurable conditions, their case management has been cut off. They are already referring to us. We're glad to take them, that's our role. But our ability to do that, to provide enough visits with the intensity necessary to see them, to serve our partners in them, we don't really know where that's going to end. So, one of the other things that's in the rule change, besides making those barriers that I talked about, defining kids so that they're pretty far past any sort of primary or secondary prevention. They're largely in a tertiary medical situation, okay, tertiary care. They also remove the nutritionist as an essential part of the team. Cleft lip and palate, feeding issues, feeding tube issues, baby born with cleft lip and palate. And the example I began to allude to, we've just already received, just in the past couple weeks, 3 situations of children that have already had chronic conditions that lost their case manager, referred here. We are so glad people are referring them here. We are going to keep our doors as open as we can. But 2 of those had critical nutritional needs. One infant had gone from being 35% on the expected growth chart to 1% when that case was referred to us. So taking the nutritionist off the team is, again, it's completely counterproductive. So that's where you have so many whereases. There's so many good reasons not to do that, that I think our challenge will be in our testimony of picking which are the most important ones when we get to give our 3 minutes. You will be the first board in the state simply because of the timing of your meeting, but the other health officers that provide, their offices provide TCM, there's 8 of us, are waiting for your action on this. I want to close, and I realize I'm being but this, we've all made cuts, we've all made a lot of cuts. This one is heart-sickening. Besides, to throw prevention out the door. The bullets that you see in the now, therefore, be it resolved, I think, given my little impassioned speech here, are pretty self-explanatory. But we wrote them that way because we don't know what's next, and we don't know what's going to come out. And frankly, we don't know who's proposing the changes, except that officially they're coming from the Secretary of State. When you do propose rule changes, you get notified by the Secretary of State, which that system isn't working either because we didn't get notified of the first rule changes. You've since signed up and you didn't get notified of these changes. So that's another issue. It's very hard to keep abreast. But the things that we have in this bullet, low barriers for referrals. I don't want a client to have to think about, and explain that their public health nurse cannot work with them at PHC, or if they just gave birth at community, or they're a Medicaid client, that we can't get reimbursed for that. I don't want them to be even have to know that that's going on. We want criteria that allows us in the earliest stages of pregnancy and life, not after chronic conditions and tertiary care is needed. We want the state to recognize the incredible local investment that all local health departments have made to make TCM for this population, and not just, I'm going to use the word trash it. It's 30 years of growth. A local health department, smaller than us but not small, has just spent 3 years building up their infrastructure, their training, and the billing system in order to be eligible to bill for TCM. That is not considered. That infrastructure is trashed. We want the recognition that you do need a team that does include a nutritionist, and that cutting a nutritionist off the team, I have no idea where that came from. We want recognition in their outcome that TCM is a part of home visiting, and it's in the home and the school and the daycare and the places where we meet with folks where the child, the pregnant women, and the fetus and the child are developing. Once we get them into PHC, Dr. Sanger, for example, I know that you have incredible prevention messages, screening, and things that you do, but they got to get in. And then when you give them your advice, I'm sorry to put you on the spot here, mom goes home, and she knows it's the nurse and the nutritionist that could have intervened so that child didn't drop from 35% of the growth chart to 1%. We want recognition. The other thing they've changed in this rule proposal is that TCM can only address physical needs. Only address physical needs. The mental health care needs in this state are huge. Anyone can speak to that. But they very specifically said physical needs only. That is intentionally to cut out behavioral, developmental, mental health needs. I would argue substance abuse, which is a screaming problem in the state. And we would finally we want to put ourselves last, an eligibility and a reimbursement system for TCM that we could actually manage. We do not want to serve people and take our budget to you, to the county commissioners, and find out that 60% of our billing has been declined because the system keeps changing and changing and changing. Those are the best things we could come up with an excellent team of experts, Sarah Heineman, Vicki Dundas, Levon Blunt, in short order, that we would like you to add your voice as a health board for future use of your voice.
Jean?
So I know this impacts the visiting home nurses. Does it also impact the nurse partnership nurse?
Yes, it does. One of the
Family
whereases
partnership.
speaks to, and there's so many, and I think that's why I had already forgotten the tobacco ones by the time I got to this one. Sign of age. One of the whereases speaks to, I will find it. That's a problem with whereases, they don't have numbers. Here we go. Third from the bottom of the first page. Whereas this health department's evidence-based home visiting programs, and there's more than one, we operate two, by state-encouraged design. The state budgets, because they give those grants, that's federal money, and they specifically expect that you will supplement your budget, basically make your budget work by TCM revenues. So our evidence-based home visiting programs by state-encouraged design rely in part on TCM revenues to be sustainable. I did a survey of the local TCM providers in October when we were fighting the first rule change. And all of them that provide evidence-based home visiting programs, 100% rely on TCM to keep that program whole. So There have been bigger cuts. There are agencies that are hurt harder. Our partner agency at Partnership has had issues. This takes away prevention for the most vulnerable women and children in our community, and thank you for listening to my speech.
So how does this relate to what's been on the news the last 2 days then about how the state's going to come in and save us with
Yes,
30 people statewide?
There is, that in fairness, there was a very recent effort by the Maternal Child Health Division, who operates our home visiting evidence-based grants, to do a good thing, and that is to work across the silos in their department with the foster child, the welfare division, whatever that is. I have Child and Family Services. I'm very sorry, we're not even supposed to use that name anymore, I apologize. To take some money that they have, federal money for home visiting, which really could have gone locally at any time, but to take it and to push it out a little further into the community. So they are doing that, and they actually visited with us, and again, good intent, good intent. I'm speaking about effect. I want to keep that separate. I'm not questioning intent. Good intent. And they wanted to very quickly put that money into one of the evidence-based programs with his parents as teachers. It's a fine evidence-based program. In our community, another agency does that. We are fine with that. We helped them get started doing that. But the state arrived here, their representatives, inviting us to the table, thinking we were the ones that delivered it, and we all sat at the table. I was absent, informing them that, no, we don't do that. Yes, but you see the referrals from Child and Family Services. Yes, we do. We have those clients. That money, by state decision, will only go to that particular evidence-based program, and that is operated by an agency in town, good agency, that doesn't see those kids. That's the kind of stuff that's happening.
Boy, it's
So,
a miracle according to the.
So it did look, I'm not gonna say it's a bad thing. It's a well-intended thing, and it's going to help some communities, but it completely, it is not the strongest in terms of the research-based evidence for outcomes. It may not be up to the match for these kids.
So kids from Child and Family Services are not referred to the organization that
No,
does
they are
PAT
not,
here?
no. Despite that input, they were given the instruction to start working. So we will be at the table. We're meeting again with Child and Family Services, I think, on Monday, with our local representative. We're talking about a couple things, TCM, but we're primarily meeting because you will recall that our foster child health program was lost without anything other than written notice in October, even though we were providing those services. So we want to talk about that first. I'm not carrying on about that. I'm talking about our basic TCM funding. So we will do everything we can to help that agency that may get those funds. We have absolutely no resentment about that. We just find that the effect is that it's going to be very difficult to help, and well, many of those kids continue to be referred here.
Duplication of where they're going.
Mhm.
Seem to go against their own rules.
So Ellen, without any emotion on this, what do you think the return on investment per dollar spent in prevention is?
It depends which research you read. I mean, if you're looking for getting immunizations in timely, it's $10. If you're looking at one of the higher intensity home visiting programs, such as Nurse Family Partnership, of course, it has some limited eligibility. Not all treatments are the right treatment for that client, so let me put it in those terms. We have double-digit improvement outcomes and things that last 14 years later into life that include behavioral issues, pregnancy, lower pregnancy, lower substance abuse. So an evidence-based program that has at least one outcome, as parents as teachers does, has its place, which is why we helped a local agency bring it to Missoula and didn't try to bring it here. It's a good way for our partnership to operate.
Just
We
find it
will
remarkable.
help with that, but if you read the news article that this was somehow saving all of this, it has nothing to do with this.
Well, I just find it remarkable that DPHHS decided to cut this when these programs tend to have the highest return on investment for population
Yes.
health.
Yes.
I mean, for the longest time, this was the only metric that the WHO measured globally was maternal and child health and mortality. That was it. I mean, that was,
Mhm.
I mean, that's been a gold standard for the longest time. And considering how high our statistics are in the state, I just don't know who made this decision, who thought that this was a good idea. I think they would have cut something else. And knowing all the case managers that we've lost within the county, I believe they're state employees, where are those folks gonna go?
Well, they're calling here, and we totally wish to serve them. But when targeted case management was implemented in the state, when Medicaid first made it available as an option for states, this department, along with we were one of the pilot spots. It was considered it was to help do what we were already doing 30 years ago, to give enough leverage and enough predictability for the Medicaid clients. And it doesn't pay for the home visit. We don't expect it to. It's not going to pay for the education and the parenting. It's not going to do that. We don't expect it to. But it leverages all of that expertise and service, so that if a client comes home from the hospital or their primary care physician with a care and feeding plan in the home for a cleft lip and palate, we're there. So we're going backwards 30 years on this.
So let's say this stays unfunded. I mean, between you and Dr. Stenger, what do you see happening in this community?
Well, whenever you squander an opportunity to prevent an early life, many of them you lose. I mean, the seeds of chronic disease, social problems, learning problems are, pregnancy to 3 perhaps.
Yeah, and I mean, I think just, sort of in the short term, case management and home visiting for vulnerable kids and kids with complex medical issues keeps them out of the hospital, out of the emergency room, prevents healthcare crises that can be life-threatening. I mean, this is, the child that went from, 30% weight to 1% weight is headed towards a hospitalization.
So that's what I'm getting at. So cutting this $200,000 could realistically turn into millions of dollars of cost to this community.
Absolutely. Depending which studies you read, some will say 15%, but I don't want to just throw those numbers about, because each program and each outcome is a little different depending on the population it's used for, when it's used, that eligibility. But it's definitely not a dollar for dollar. It's dollar per multiple of dollars.
No, what one day in the ER is $3,000 minimum.
Right.
That's one ER visit. So, I mean, that's gonna be that mom bringing her kid into the ER.
Mhm.
It just seems ridiculous.
It is, and the rule changes themselves don't eliminate the program. The rule changes
Shift. They narrow the parameters
It's
for
almost, while it may
eligibility.
not be intended to be a backdoor elimination, it has the effect of restricting the majority of clients that need it and restricting any reimbursement for the majority of clients that we serve. So it would stay on the books, but it would be reduced by a figure over 50%. I don't know, but the majority of what we do would be reduced. We do have incredible support in our tax dollars from the city and the county that we've devoted to this. We're going to put that to the very best use, and this is a very good time to acknowledge that, because departments that depended mostly on this do not have that. So I really want to acknowledge that we don't have quite, we're heartsick, but in terms of our ability to do the best we can, we still have a good ability there. But the idea that there's a state and local partnership doesn't feel like that's in place right now.
I'll make the motion to accept the resolution for supported target case management from the board. I think it even needs to be stronger than it is, but
I had to change some of my language to get it more.
politically correct.
Understood. Any public comments on the motion on the floor? Any other board or staff comments?
I guess the one thing I would say is, in light of what's been on the news and, case managers in other agencies and other venues being laid off and services being stopped immediately, I mean, it's a difficult messaging place to be at where we're really vulnerable and we want to continue these programs at the same time when there's a lot of angst about people kind of getting dropped. And
Yes.
the message that we're not in a position where we're dropping anybody immediately and discontinuing these services immediately. If that's the case, and if that changes, I just think we need to be really clear about messaging,
Yes.
given what has happened with other case management and other agencies
Right.
in the last month.
We actually, on our foster care, have only been continuing the full scope until we can do a better job of figuring out how to scale that down. And the staff do know that. We did lose a nurse position by attrition already in the months since I've talked to you, but we haven't taken active to where we would actually have to say anybody at this moment, we're taking you off our caseload, but it is imminent for foster care.
It might, and I don't know what the county's position is on the website, it might be worth it to put some messaging out on the website to let people know what's happening and how things are affecting our citizens within the county. Maybe just for that reason.
There will be a meeting of the legislative, which committee is it tomorrow? Our professional organization would use your resolution after I talked to them today, adopted. There'll be a hearing on February 1st about these rule changes, and again, they are proposed, but we will use it there. We have had media inquiries. We may even initiate a follow-up media based on the news that came out Friday of, we've somehow saved this. That's dicey too, in the same way that what you've said is dicey. Because we're not trying to judge intent, we really are trying to measure effect. But I do want to make you aware that we will use this if you pass it.
All right, but just putting some public information out to let people know that services are still
Put it on our
available. You can still
website.
go to PHC, you can still come into the health department. Everybody is still working, it's just in flux, and I don't know how you might want to word that, but not waiting until,
Yeah.
I'm sure that you're probably already getting calls from people that are panicked. I have
Yeah.
no doubt.
Well, we have folks, they probably don't know that they're a quote TCM client, whereas if you go to the, if you're developmentally disabled, you know the name of. I believe our folks probably just believe they have a public health nurse like they've always had, but I think your caution is very well warranted because people have been dropped, like the developmental disabled cuts that they made. Those providers were not given the notice necessary to even begin to transition those caseloads. Those families,
There are many of them that are really panicked.
they are
scared about what's gonna
absolutely
happen.
panicked. So we will continue to say, keep referring to us, we're going to do everything we can. We are your government agency. I'm sorry, I know I was preaching to, I'm not sorry, preaching to the choir, but we can't just roll with this even if we lose. The record has to show how important this is. Because the next thing is they're gonna wanna rebuild it. And having built the foster child health system twice now and have it thrown out, we're gonna have to think about those investments. And Jean, I know you sit on the mental health board and you've had,
Yep. That meeting's tomorrow.
I'd say worse woe.
Well, most of the, I mean, there's a big fear factor there too, but most of the clients have been reassigned to different places, but they won't get as
Right.
much
Mhm.
time with people as they
And
should
we're
have.
using our cash. I mean, that's why you have cash, you know, you can lose money. We're using our cash right now so that we can do a better job in the foster child health transition. We can be thoughtful and put them first, so,
Yeah, the mental health center means a couple $1 million,
yeah,
but they serve 15 counties.
yeah, it's huge.
Okay. So on the motion on the floor to adopt a resolution on targeted case management, all those in favor, signal with aye.
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 All those opposed? Motion carries.
Thank you.
So will you be putting this on your webpage then, you think? I mean, do you think we should put the resolution on our webpages?
Well, I think because it's seen as a county agency, it should probably go on the county website. I have no problem asking the city to put something referencing your.
I have no problem. We'll put it on our
Information.
website and we
Can you
will
send it to-
alert,
Can you send it to
we
Ann?
will alert Ann and Ginny Marion both that it's on our website. If they'd like to link to it, they can do
I
that.
just think it'd be a nice follow-up considering how much press has been out lately talking about the cuts and how many caseworkers have lost their jobs. It might be a good,
And making it sound
rebuttal.
like the state is somehow saving us with their new program.
right, I think
Yeah,
it'd be a good rebuttal.
We did have a problem with it, although we did appreciate the effort. Oh.
Okay, deep breath. So, next on the agenda is to appoint a Board of Health member as a non-voting member of the TPCC.
Yes. Many years ago, the Health Board took the initiative of getting a Health Board member on the TPCC. We did not ever achieve that person being a voting member. We may someday want to try that again, but, you know, Garen, who took that role many years, felt that he was having, you know, playing a good role even without that. But that was your person. And so even though you've been getting reports under the Air Pollution Control Board, the TPCC recognizes your appointment of a board member in their charging documents. So you actually need to do it that way. It's a once-a-month meeting. And they look at transportation policy, you know, they are the policy-making joint body for the large numbers of transportation money and planning that comes into the community. And we've obviously sat there initially for air pollution concerns, but also more recently to promote alternate forms of transportation that involve physical activity. Jean, are you on TPCC now? Can you help explain
I
that?
am. I managed to avoid it for 16 years.
I know.
Yeah, so we just met this week and, you know, this week was, we had lots of presentations about enough to put you to sleep. So there was, you know, talk about what kinds of things they're looking at on the Brooks Street corridor. But, you know, the MPO is the Metropolitan Planning Organization, which encompasses the city and areas around it, doesn't go clear to Frenchtown or Lolo. So there are some federal dollars that come in that we get to allocate. Almost all the money's going to the Russell Street project for the next long time, and has been for years. That project's actually going forward. But we do have other members on the committee that are non-voting are, well, there's also the technical advisory folks. So we had a joint meeting this week, so now I'm trying to decide which ones are on which group. But the bicycle, bike ped folks are there. Of course, the mountain line is there. on the technical one, Mr. TMA. So try to look at transportation as a bigger thing, not just cars.
So I mentioned it, of course, went over it with Ross when we expected that he would be here, and we both recognized that you probably all, including our new members, one of whom won't join us until next, would probably want to think about that and see if any of the new members or existing members would really like to put their name in for that. And I recognize that no individual on the board has had the time or the information to think about that. So unless someone steps forward today, which is possible, I'd be glad to try to help someone think through that between now and next month.
When are the meetings?
They are on Tuesday, whatever week this is. This is
The third Tuesday of the month.
Third Tuesday at
Thanks.
1:30 to 3.
Yeah, I don't think it'd be appropriate if I was on it because we already have a city council representative on there. It might be a little heavy.
Yeah.
We always like Garen for his science background. Sarah Caulfield often comes and
And you could appoint James, except he's on the phone and he would know you were doing it. So I'd be, James
Or we
is.
could appoint Ross instead of show up.
Ross. But James, I'd be glad to talk with you more about the possibility of seeing if you have interest in this, as I could with Ross or any other board member.
James is
I'd be interested, but given that this is my first meeting, maybe that would be a bad idea.
I think it would be good if you'd consider it, James, if it's an interest that you'd be able to attend. I think your science background is kind of a missing piece in the people that make up the committee.
You know what, I would sit on that committee if you guys want me to, so I'm willing to do it.
When are the meetings, Jane?
Third Tuesday,
Third
But in the-
Tuesday at 1:30 p.m.
1:30.
Did you hear that, James, when the meetings were?
I did not hear that, can you please repeat that?
Sure, it's the third Tuesday at from 1:30 to 3. And they're pretty good about sticking to their timeline usually. And you get your materials ahead of time, so you have plenty of time to read. A lot of times it's reporting. But we do vote on things like whether or not you're going to put a project in the transportation plan that we send to the state and the federal and that kind of thing.
And this is a non-voting position, but I think it's still a very influential position. And we also have one of our air quality staff, air quality specialists, attend those meetings regularly. So you are able to keep in touch through staff, and you know, if you're not able to make a meeting, if that helps, so.
You know what, I would love to do this position for you guys, so.
Woo-hoo.
Great,
Yay.
thank you.
So we need a motion.
I would move that we put James Stevens on the committee, Transportation Plan Coordinating, Policy Coordinating Committee.
On the motion on the floor, do we have any public comments? Any additional board or staff comments on the motion? All those in favor signal with aye.
But
All those opposed?
It's just a
Motion
little,
carries.
an intercontinental delay.
Yeah, and I'm slowing down the opposition vote, so I don't get it included elsewhere. Next up, director's report.
I have nothing other than the business at hand, and I've already used up my time, and more so on the issues that we have today, so thanks, I'll skip that.
Next on the agenda is to adopt the community health assessment.
Hi, I'm Robin Nielsen-Sircone, and I was kind of in charge of that.
You were in charge.
I was
not
going to say,
kinda.
kind of is wrong, I was just going to say that myself. So I don't know if this is something you all got a chance to look at, because as you can see, it's very long. And this is about the fourth time I've had to do some kind of, like I went on MCAT and I did a couple interviews about it. And I will tell you that this is the most impossible document to summarize that I've ever worked on, because it has a lot of different stuff in it. And also because I think it speaks to the strength of the group process and the engagement of the people you see on the list of attendees. Because we really talked about stuff in a lot of depth. It was really fun. It was a very good process. So So basically, I would just direct, I just was gonna talk about the first couple pages where we, talk about our core findings. And it's interesting too, because I was talking to the county health roads map person just this morning about, kind of process moving forward. And she had read this, and she said one of the things that she was really impressed with was all these buts, which we were kind of wondering when we decided to frame it this way. But she just said, there's nothing that's so one-sided that everybody's benefiting or everybody's being hurt by the same thing. So she liked that we managed to really identify and call out what was good, but also find the pieces in there where not everybody is benefiting to the same extent. So, and then just the highlights of the report in general. I think we put some resources towards it that really helped out. The policy map, which is a subscription data mapping service, was amazing because it really helped us get some community and neighborhood data for the first time, especially data for our rural communities, which is not easy to come by, and or not data that's specific for them. And so it really helped us sort out some of the issues and look at where the problem spots were, because just looking at data countywide can really just bland out the data, and it's really kind of hard to understand exactly what's going on. So that was really great. And then we also had an intern, Ellen and Cindy made sure that we had an intern that worked with us from the University of Montana over the summer, who did some surveys and some more outreach to the rural communities. So that was a really big strength of this as well. And we also got to use some maps and
Yeah, we got to
surveys
use
and
the maps this
interviews.
time.
Yeah.
It's advancing.
Yeah, so it was a really nice step forward as far as that goes. So, and then we're going to be moving into the community health improvement plan piece of this starting next month. So have some plans underway for how we're going to do that. It's not in this report, but in the last couple meetings, the issues that we really forgot my cheat sheet on this, but that we really thought the group wants to move forward on are, one is kind of a systems piece of making sure that we're doing some collaborative or coordinated data collection or better data sharing when we collect it, so people aren't collecting the same data all over town to use in assessments, that maybe there's some more coordinated assessment pieces that could happen too across town. And one of the partners that's interested in that is the Missoula Economic Partnership. We found that out doing key informant interviews. The other piece is to continue forward on a couple issues that just rose to the top that are really big deals, and that would be mental health and substance abuse. And some of that is honestly probably just going to be building some relationships to see if we can create a foundation for some coordinated work to be done, because we just aren't there yet. There's a lot of stuff happening, but there just isn't that kind of coordination, and we don't have all those people at the table. The other thing is the dental group that has been working in the past Community Health Improvement Plan has really been a great, truly collaborative group, and they have requested that they continue getting some organization through the CHIP process, because they just don't think they would continue to exist as a group if they didn't get some help behind the scenes. And let's see, and then we want to continue with Invest Health, kind of under this umbrella of Community Health Improvement Plan, or at least pieces of it. We'll see how that works in the future, but that's just the concern about the built environment and housing and all that policy, bigger development policy can kind of fit there. And then the pieces that are the big concern about young childhood, the child abuse and neglect in particular, but also the lack of affordable childcare. We're looking into seeing how we can collaborate with and through the collective impact work that's going on, and Healthy Start that's more centered over at United Way, who is one of the partners at the table as well, so that we can figure out how to maybe make some gains on that. So that's where we're at. But any questions or anything else you wanted me to touch on, Ellen?
No, I appreciated that this document, even though we ask you to adopt it, has an awful lot of community buy-in and ownership to get to the state that it is in front of you.
Remind me again, is it the same group working on the CHIP that works on the job?
It'll change somewhat. For the first, we're still working under the 2015 to 2018 CHIP. That'll expire in June. So there's groups working on pieces of that. But there will be several players from this larger group that are interested in going forward to at least shape the CHIP. And then depending on how we land on what kind of work we're actually going to do, then it'll just be recruiting some new partners who we need to really make sure that work happens. And some people will be done at that point, and they're, for the moment, they're. But the one thing that will be ongoing is we'll continue to do some data collection and invite the whole group. We have invited groups to training, so that the CHOG group as a whole continues to be, there's some communications and some events that they're invited to and stuff like that, so.
I have a question that I'm sorry to bring up in this
No,
group, and
it's
it
okay.
probably reflects my confusion. Doesn't this become the 2018 Community Health Assessment?
Last time we didn't do it that way. We put it was the year that we did it in, which was 2014.
Okay.
So I just followed suit.
Okay.
And did it the same way this time.
I just want it to last as long as it can for accreditation purposes.
Can I point out too that we're going from, in the past, we've done a 3-year community health assessment and community health improvement planning process, and have figured out that we really need to move to a 5-year process, so that we're not just doing process the whole time, so that we can actually do some good work and have the time to do it.
Yeah, because that has been an issue, especially this time, because we finished the 2014 community health assessment, started off with the CHIP, started off pretty strong, working on it, and then you almost immediately are back in the cycle of having to collect data and put together this report and run these meetings, and the CHIP kind of, as much as possible you get back to it, but it falls by the wayside a little bit, so.
So both going to 5-year cycles or just the CHIP?
Both
Yeah.
will go to
Okay.
5-year cycles. We did talk with the hospital about it. It is difficult for them. We have one nonprofit hospital and now one for-profit. It used to be that both hospitals, being for-profit, were under new IRS regulations that require them as part of their nonprofit status to work, and it's quite specific, work with the local public health for community health assessments and needs. So we started out and we tried to stick on the 3-year cycle, but we just couldn't do it. So that we did talk with St. Pat's, and even though part of that's difficult for them, they also participate in this, and then they do what they need to do to meet the needs of their institution and the IRS.
Okay.
I guess I'd move that we adopt or accept or whatever we do, the 2017 Community Health Assessment. Thank you for all the hard work.
Yeah, thanks, it's been fun, I really love it.
Any public comments on the motion?
Go.
Any other board or staff comments? I have just one. I did want to comment that the sort of improved graphical look, it's really easy to read and be captivated
Great.
by the data just
Oh,
because
good.
it comes out to you. It's a really nice presentation. It's well
Thank
done.
you.
It's wonderful to have someone with a master's in journalism actually do that.
Yeah, and we also, Christy Scheel was hired for the PMQI coordinator right before this started, and she did the majority of the data collection, which was awesome. It's a two-person job, it's better.
So on the motion to adopt the community health assessment, all those in favor signal with aye.
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 All those opposed?
He is present.
Hearing none, motion carries.
Thank you.
Will this now be on our website?
Yeah, the draft has been on the
It is,
website, so
yeah,
now
out
it'll
there.
be show that you've adopted it.
Yeah.
Okay.
Great. Next item's deferred, so next up is journal report. Julie, did you have one ready?
Yeah, this will be fast.
Okay.
And I only brought this up because it's been in the news, chronic wasting disease. They've been
Oh.
doing some shoulder hunts, and people have been very concerned about CWD showing up in elk and mule deer. They're doing shoulder hunts for mule deer right now, and
What's a shoulder hunt? Is that like an extra hunt?
so
Okay.
they're doing a shoulder hunt specifically outside hunting season
Okay.
Shoulder season.
to mitigate CWD right
Okay,
now.
thank you.
And even though it has not shown up in Montana except on the border, and I think there's one confirmed case and one suspected case, they're telling hunters, if you see a deer that looks clearly emaciated, doesn't look well, stumbling around, don't eat it, obviously, bring it in. The one thing that I was not clear about is exactly where you bring it in for testing. And most people are saying take to Fish, Wildlife, and Parks or the Health Department, but I don't think that you do the testing here at all. So I would
No,
tell the
don't bring-
public,
no.
don't bring it to the Health
We don't even want
Department.
dead ticks, let alone elk.
Right, don't
No.
bring it to the Health Department. But I would just let you know that their widespread state message was for the lymph testing.
Thank you for giving us that. that
Right,
heads
so I would
up.
also tell hunters that if you do decide to eat an animal, the tissues that it is found are the neural tissues, the brain, spinal cord, the lymph tissues. They're saying eyes, things of those that I don't think hunters eat, but maybe they do. Let's not eat those things. It cannot be transmitted. They don't think it's zoonotic. It cannot be transmitted to other animals unless it's through injection, and that has only been replicated in a lab. So at any rate, I think it's relatively safe at this point in time, but it has been in the news lately, and there have been some sensationalistic articles about it jumping to different species, and it has not done that. It's not even done that in the lab. So anyway, that was just, thought I'd bring that up, and I'll give the articles to.
Do we
Thanks.
have a volunteer for the February meeting, which is on the 15th? The earliest date we can meet, next month. Any volunteers for a journal report?
Which month is all that week, so.
I can do February.
Okay. I'm going to say it, but I'm guessing there are none. Public comments on items not on the agenda? Okay. Board and staff comments on items not on the agenda?
I do want to send some email, some plan, some doodle poll to board members, past board members and new board members, because we didn't get the chance to say goodbye to, or roast Garen. I'm not good at the social event front, but if you have a general interest in trying to do something if we can, I'm going to send something out so you can let me know about that.
Great. That sounds good. I did want to acknowledge and welcome Julie back to work. We're happy to have you back. And
She's part-time. Kathy has been very ably filling the other time. And the third person who is a part of this critical team, also, she had to go in for a surgery, and so now is on medical leave, and they're pulling it off.
Great. Well, thank you for all the support. And just a shout out to Ross, and best of luck today over in Spokane with his wife having an emergency surgery over there. So, we'll adjourn now as the Board of Health and reconvene as the Air Pollution Control Board. And we don't have minutes from November, so we'll move to item number 2, which is action on proposed letter to Board of County Commissioners to recommend reinstatement of the dust abatement program.
So you have the letter in your packet. I think we're moving along more quickly than we expected.
Well,
so-
actually, I saw Jan was out there, so I
Okay.
think she's.
Oh, she's just getting her, okay. This was on the initiative of the Air Quality Advisory Council to the board.
And sorry I zoomed through the journal report. I thought we were that we might be needing some time at the end of things today, but.
No, thanks, because I know some people have to leave.
Well, I guess. This reconvene needs to happen like it's listed, right?
Is Jan not there?
Yeah, they're coming.
Okay.
Oh, okay.
Sarah. And Jan. She's on her own.
It was kind of fun. I saw a bunch of fun Facebook articles on zombie deer, and people were believing that was a thing.
The what kind of deer?
Zombie deer.
Zombie deer?
Well, and that's what CWD was, and they were
Oh.
in a panic
Oh.
and convinced that, people were convinced their dogs were getting it in the backyard, the deer were jumping into their backyards, and it was just ridiculous.
Yeah.
It's not a thing, people.
You also don't need to eat soap, right?
I think we,
Tide Pods?
Yeah, Tide Pods.
I think humans
People
find
are doing
things to
it.
be afraid of so that they don't have to focus on the real
Posting it.
threats right in front of them. So, that would be a good example.
Oh, Jan, we're ready.
Jan, we're ready.
Yeah, sorry,
Right
I already
here.
had called it and realized
Ready
that you
for
weren't
ya.
sitting in here, so.
It's good to be back. Is this on?
I think so.
Okay. It's been a while.
Yes?
So I'm reporting on 2 meetings. Okay, the first is our December 5th meeting. And we had no article. We had one major action item, and that was on dust abatement in Missoula. And Eric Dixon, the transportation engineer, was there to talk with us. And he had said that because of finances, dust abatement had been curtailed for budgetary reasons. And so we discussed this at length. And he said that the increased maintenance that resulted from not having the dust abatement could actually cost us more. So we discussed this and decided that we wanted to ask you if you could reinstate the previous dust abatement program. And we sent you this letter, which you have, and this letter, which we hope you'll accept and send on. So
And
that-
the second letter, just for our viewer, our MCAT
Oh,
viewers.
I'm
The second
sorry.
letter is, you're asking as the Air Quality Advisory Council for the board to send the second letter
Yes.
to the county commission?
Yes, that's right.
Yeah.
So we wrote a letter to the county commissioners, with more detail than what I've given just now, so that they'll understand the real reasons for this request. It is a health safety issue. We know that this dust is really unhealthy. And we can't do anything about the wildfires we have in the summertime, but we certainly can do something about the dust that some people experience in particular areas and get those protections back for them. So that was our request. And that was a fairly short meeting. We didn't have the discussion we had expected to have on homeowner realtor compliance regarding wood stove removal. The situation now is that when a home is sold, if the wood fireplace that's in it has been grandfathered in the past, once the home is sold, that stove, that fireplace cannot be used. It would have to be replaced with a pellet stove or a gas insert, natural gas insert, or propane. So we had just a little bit on that, and also decided that we needed to see what the rules are and what the Air Quality Advisory Council's role can be on that issue. So that was that meeting. Okay, the second meeting I'm reporting on is the January 2nd one. And Guy Hansen of the Axman brought the article for the day, and it's Radon in the Home from the Hearth and Home magazine. And he said this is the best article he's ever seen on radon, and it's fairly lengthy, but it's interesting reading. Most people don't realize that radon is the second greatest cause of cancer, second only to smoking. And it needs to be, your homes need to be tested for it. The distribution in Missoula is irregular, so you may have a radon problem and your next door neighbor may not. It actually comes from a breakdown of uranium naturally occurring in the soil. And the outgassing, especially with our homes being more tightly built, it is more contained within the home. It doesn't escape. And so what we need to do is provide a safe and easy escape for that. And I also didn't realize that the higher the barometric reading, the lower the radon release is. Anyway, it was a really interesting article. Next thing we did was elect the chair and co-chair, and Kathy Tonneson and Bert Chesson will remain as our co-chair and chairman, and that's working out really well. We had a lengthy discussion that was started by Martin Twir, who did a presentation on the newer wood stoves that are much more efficient and cleaner burning. 3 of the members of the Air Quality Advisory Council are in the wood products industry in one way or another. So it was an important discussion and of importance to people who were there. What Martin was presenting, what he proposed, was allowing people with non-EPA wood stoves in the air stagnation zone to replace their old inefficient stoves with new advanced wood stoves instead of pellet stoves. And this was kind of a brain exercise because under current regulations that can't happen. But there was some discussion about the ability to change that regulation. But there was a lot of pushback on that idea. Some of the new wood stoves on the market for about $3,000 already meet the EPA's standards of getting less than a 2 gram per hour from pripwood or 2.5 gram per hour with cordwood. They have more automation and they're more efficient. Sue Spanky asked what happens when the oxygen sensor stopped working. And it came out that the fireplace could then operate as just a wood stove, but it would be less efficient and there would be more emissions. Also, we questioned the wood that they're burning in those stoves is always dry wood for the tests. But in real life, as we found in Seeley Lake, it is hard to educate people to use really dry wood. And so if this stove can accept wet wood, you're still increasing the risks to the people. Also, when you open the door to a wood fireplace, it doesn't matter whether it's one of these high quality ones or one of the old ones. You open the door and that smoke comes out. And many times it's as loaded with PM 2.5 as what you breathe in during a wildfire. And I always enjoyed, we had a wood stove for about a dozen years. I enjoyed the smell of that smoke. And at that time, I didn't realize that it was so unhealthy. Okay, I marked just a couple of things in the minutes that are going out. Because this is a serious discussion for us, I'm taking a bit more time than I usually do. John Altman asked the question of whether or not wood burning would eventually go away. And he said he doesn't think it will where he lives because houses never sell, they just get rented. And renters don't always worry about whether or not their wood is dry or wet. And he said that we need stricter controls, stricter stuff is what I think he said in Missoula, to limit the production of wood smoke. There were a lot of comparisons to pellet stoves, and pellet stoves don't work if you're burning wet wood, they don't. But these new wood stoves can. So just a couple of other things. Tony Ward was cited a couple of times in his work at the University of Montana working on wood stove smoke interventions, and they found that education is not sufficient to get wood stove users to change their behavior. Martin is proposing allowing people who have pre-existing non-EPA certified stoves, which are destined to be removed when the property sells, to allow them to replace those stoves with new wood stoves. But there's a fairness issue. Other people have not been able to put a wood stove, a new wood stove in, and also what happens when the house sells. So it's a complicated problem. And there's a question of the restriction against installing wood stoves is federally enforceable, and the rules are part of Missoula State Implementation Plan. But it's really hard with the number of employees we have for people to get out into the neighborhood and check on who is compliant and who isn't. And that's all I have on that. There was no public comment. I think that's it. Any questions?
Thanks, Jan. I think I have a question. I want to reverse back to the dust abatement.
Yes.
You mentioned that Eric Dixon said that, that they may be evaluating trade-offs between dust abatement and increased maintenance, the costs of those. Is that something that Eric's going to report back on, maybe to the county, or I'm not sure. Jean, maybe you have awareness of this as well.
I was scheduled to do this presentation in December, and we didn't have a meeting. And I intended to contact Eric in advance to have him here. I only recalled that this morning and called his office, and he wasn't in. I think he would have been here if he could have, but you might want to have a discussion with him so that he could give you more information.
So it is something that we have talked with the Public Works Department about before, because the mag chloride is the product that they use, and it tends to hold the road together, so it needs less grading and that kind of thing. They still grade the road every year to do dust abatement. So they have talked about it some. But the commission has talked to them too about, we don't like this product. So while as hot as it and dry as it was this summer, I'm not sure that the dust abatement would have made that much difference, just because it's a salt-based product, so it requires moisture to reinvigorate itself. And when it's too dry for too long, it loses that capability. When it rains, it comes back. I can tell you that our office gets probably as many complaints about what mag chloride does to the environment in vehicles as they do about dust. And there are some other products on the market that we have asked them to look at. I just did a little bit of research. I would speak against sending the letter to the commission. If you look at any road that's had mag chloride put on it, especially along the highway, and if you look at pine trees, they're dead. They're dying. There's been some research on mag chloride products on the roadside vegetation, riparian systems. It also, it gets in the soil. If you drive on roads that have had mag chloride for many years, like Lindbergh Lake Road, at this time of year it is artificially not frozen, and it creates a big old mess, and it turns into snot. I've had, my brother's had me help him clean his trailer to show me how much it's rusted out, his, trailer that he pulls his equipment on. So while there's advantages to not having it in the air, it's not that good for our environment either. And I also think that budgets are going to get tighter, and we're going to have to figure things out. The reason that we didn't do dust abatement this year is because we had so much rain this spring that we had large failures of roads and needed to put the money to put the road back together, and that was the only place we had to take it. We've lost $400,000 from the secure rural schools not being reauthorized at the federal level. So, know, you have to make decisions. I understand that people don't like dust, but they also don't like their water. And riparian areas being ruined and trees dying and vehicles being corroded, so I don't know that I think it's appropriate for one department to tell another one how to spend their money.
Would it be appropriate for them to change their letter asking for just more research into alternatives to what you currently use?
Well, I think we're already doing that, so.
And I have a question again for Eugene. Last year was this one-off to use the money to replace or repair the roads that were damaged from the rain. It's something that's taken up every year for budget considerations, or?
It's usually in the Public Works budget. We'll be, you know, in a month or so, we'll be looking at mid-year budgets, and I'm sure it'll come up again. So we didn't take it, you know, out permanently, but the federal money has been removed permanently, so, you know, as the price of everything else goes up, it'll be one of those, it's kind of like taking away track when you need to teach kids social studies, you know, and that's just kind of where it ends up being, but I'm sure it'll be in the discussion as we do budgets.
And the staff have been talking with the commission and Public Works along the way, so I'm not speaking against or for the letter, but from a historical point, I remember when there wasn't any dust abatement on county roads, and while I wouldn't want to go back to those days, I don't think we're saying all or nothing right now. I think we're looking at something else. But I clearly remember when they were able to put some of that money, when it became available to do it, and we joked about, well, when that money runs out, we're going to be back. And unfortunately, at one level, I realize we're at that point because we get the calls too. We definitely get the calls. We would love to avoid, from a staff perspective, that situation. But I'm not picking up from, at the staff perspective, that the conversation is all or nothing. I'm picking up, and I'm speaking of the broader staff. I'm not trying to speak for you guys. But as someone who sits at the management table in the county with Public Works and the commissioners, is what can we do? This year it was abundantly clear that they had to do maintenance, and they made us aware of that. So that's not an answer, but it's just a little historical perspective on how these things, that pendulum comes back and forth, largely based on funding.
And there were a lot of private parties that paid to have the dust abatement done on their roads, as they always did. And probably some of the folks that we used to do in front of their house did it too. So the companies that do dust abatement were out there wrangling up business like they usually did. So it wasn't that roads didn't get abated, just not as much.
Thank you. So with respect to the letter that's, you know, in front of us, I guess, what's our pleasure on this?
It sounds to me like they're already aware, they're already working on alternatives. I'm not sure. We have a commissioner sitting here. She's telling us there's not going to be any different action than what they're doing already right now. I would say just not send the letter. It seems like they're already aware of it, but sometimes these things are largely symbolic, so what do you guys think?
I was going to say tongue-in-cheek, maybe we should refer it to the Water Quality Advisory Committee to see what they think. But maybe not so tongue-in-cheek.
No. They have looked at what materials are okay to put down.
Right, we don't do road oil anymore. But it does say that think it moves about 12 feet from the road is what the study out of Colorado shows, how far it moves in the soil. And aspen trees tend to take it up more. I always notice that pine trees are the ones that seem to be the hardest. And part of it is just that we're in a drought, so they're already stressed. But you can see along the highway where the slush from the snowplow hits and affects the trees. So.
Does the chemist have any opinions? Talking to you, James.
Yep, no, I'm listening, sorry, I was about you, so I was trying to undo it. So. I think from looking at assessment on the material, I want to really look at if there was correlating data for that environmental damage cost from the dust abatement material versus what the coarse particulate being generated by road dust being dust. It could be a simple data calculation on the proposed health impacts of those materials versus each other. It probably make it just more a cosmetic issue or a slide issue on the dust abatement chemical, although I know that's a concern for the county commissioners. Board of Health perspective, my assumption is the Board of Health would want to recommend what impacts the largest health driver, even if that kind of goes against potentially a beautification or kind of environmental, I guess, beauty perspective from my aspect. So that's really my thought on it. My remembering on it, although I don't have a reference in front of me, I think mag water is relatively benign from my understanding. But there's a lot of views and a lot of those issues, but I'd have to review the data. If anybody has that available, I'd love to get through it and kind of give a better and more concise assessment by the next meeting for you guys.
Sounds like it's in line with what we're all saying.
So how about this? We meet with our Public Works Director next week at our regular meeting. I'll take the letter to him and maybe we could even just work closer with the air quality staff as we choose roads to dust abate to kind of look at, where it could have more impact and, I know that people would like us to pave all roads, but paved roads really take a lot more work to maintain than a gravel road, especially when you have to pay to move asphalt 80 miles. So that's probably not a solution, but I can ask them to work closer with that air quality to maybe have some focused.
I think that's great, and it's just one to watch, and we'll just look for maybe a report back in for, as the budget works through the mid-year check-in on what you guys may or may not be able to do this summer. Good.
Yep.
Thanks. Sarah, TPCC update?
All right. Sarah Corfield, Air Quality Program Staff for our new board member. Don't know who I am. So I was at TPCC as a member of TTAC. There was a joint TPCC TTAC meeting. Jean was also there, so if she has anything to add, she certainly can. First order of business was electing the chair and chair and vice chair on that board for TPCC. They stayed the same with Commissioner Strohmeyer as I believe the vice chair and Jordan Hess as the chair. Next was looking at a amendment to the TIP where they just moved money around between years, which happens frequently. A lot of the amendments to the TIP end up just being
Always moving
money around. So that was a pretty quick thing. There was an amendment to the Unified Planning Work Program for Missoula in Motion and the Bicycle Ped Program. They're wanting to hire a consultant to put together their strategic plan, and it turns out they can't use CMAQ money for that. A lot of CMAQ money gets funneled into those programs, but CMAQ needs to be used for specific projects and not for strategic planning, so they needed to find another source of money. Not a huge amount, it's a little over $6,000, I think. Got moved in that for their strategic planning, which is great for those groups who are working together and doing good work. So that was also approved. Then there was a discussion about the Russell Street Committee. As we are starting to move forward with Russell Street construction, there's a committee that I believe MDT would play a large role in having put together that is similar to the design committee that was involved in trying to make sure that Russell Street was, would be designed within the expectations, I think, of the community. This committee is really kind of the financial reasons to sit there, and as the construction is being undertaken and they come back and say, hey, we need to change this will cost more, this will cost less, proposals that the committee can look at and respond to quicker than TPCC as a whole. TPC as a whole body still needs to approve how money gets moved around, but this committee will have 3 representatives from TPCC on it, so that TPCC is generally up and aware of what's happening, and will hopefully, according to MDT, be a fairly nimble group that will meet with publicly noticed meetings, and you can come to them. I think it was Monday mornings at 8 or 8 o'clock morning meetings, I caught that much, for people to come and hear what's up and provide any public input. So that is great. We're excited to have Russell moving forward after, I think, 20 years of planning, so that'll be great. We had a presentation on the proposed airport improvements. This is going to be a very long project, but I think the nice thing for all of us is that it is not using any public funds. But they had a chance to show us what the design constraints were, but also what's being done to expand the ability for growing larger in the future. Up to 20 airplanes could be there at one time, far into the future, with the ability to expand their ability into it, which is nifty. I like the observation deck where people can come and watch and see planes land with their loved ones on them. I think that's a cool thing. But that will take many, many years to complete. The first thing they're going to do is relocate security and then tear down the existing security and start doing stuff. But it's going to be many, many, many years before it's all done. We also had a presentation on the Brook Street Corridor Transit-Oriented Development Infrastructure Study, which is a pretty darn large study. It's not done yet. This was more of an update of where they are so far, where they're looking at many, many different components of what goes into designing that corridor around transit. Is there the housing density? Are there the jobs densities? What are the property values like? Are there underutilized places? How can you redesign the streets? And it was a lot of information that it's not completely done yet. I think they're going to be bringing it to the public next month or two, hopefully, and go forward from there. We didn't have time to look at all the proposed traffic changes. I think the only really major one that is going to potentially draw some attention would be taking the street from Stevens, Brook Street from Stevens to Mount, and go from where it's currently 2 lanes traffic in either direction to a 3-lane traffic, which is better for pedestrian safety, but would definitely change the layout of that street. It's a fairly underutilized section of road compared to the rest of Brooks. So based on our modeling, I think it could handle it, but that's the most dramatic potential change, as well as where to put a new bus hub and changing some routes around. So it's a great big study. We will be continuing to hear from, I'm sure. So that was TPCC. Anything I missed, Jean?
And so, James, that's the committee you just volunteered for.
We're going to learn so many acronyms.
Excellent.
I might propose, though, that the Missoula County Airport Authority have a race with MDT to see if the terminal expansion can be completed before Russell Street. And I put my money on the airport.
And we'll be spaceshipping around at the time.
The nice thing about the airport expansion is that they've figured out how to phase it in without disrupting the service. So the Big Bear will go in a closet somewhere, and that's where you'll have your go through TSA. But you'll also then be able to go to the restaurant because you will have already gone through TSA. So there's pros and cons, but it's a nice nice improvement needed.
public comments for items not on the agenda? Hearing none. Any other board and staff comments on items not on the agenda for Air Pollution Control Board? Hearing none, we will adjourn and reconvene as the Water Quality District Board. And we do have minutes from November for Water Quality Board. Yeah.
James, if someone can send me the exact dust control product the county uses or proposed to use, I'll cross-reference that as well too. I sent an email that said the same thing.
Okay.
Jean will do that.
Can you copy Ben or Sarah in? Thank you. They probably know, but just in case.
Anyone on the minutes?
I was not there, but the minutes looked fine. I would move approval.
All those in favor of approval of the minutes?
Aye.
Aye.
And M2 Green's money, which is on this thing, is in the bank.
Yay.
Okay.
Uh,
What's going on right now is we're getting Anna Conley the notice that she's to call in as you get through the
Are
rest.
you guys doing that?
Yeah,
Okay.
that's, but
All right.
you can, and she'll be calling in on the same line that James is on.
Okay.
And when you get through the rest of your water quality agenda, then MCAT will leave for the allowable closed session.
So we're looking for Travis.
Yeah, that's the
I'll
other
get to
thing
the
that we're
other ones,
doing, is
so-
looking for Travis.
Public comments? Hearing none. Any, for Water Quality District Board, any board and staff comments on items not on the agenda?
She's looking for Travis. Could you go ahead and call Anna? Because I
That was in
realized.
the mail.
Should just request it.
That's not supposed to be.
Okay.
That's left over from the
She's
treasurer.
already got it.
Okay.
We thought you were looking for Travis. Oh,
That's all right.
but that's okay.
You got
I
a
thought
call
you
out
were-
there too.
Because he also
Okay,
has
so
this.
Anna's with you.
He's researching it right now.
Ray Davis, but it's
Just
different.
show the phone numbers.
Oh, yeah,
This is-
they
this
just
is-
took
I
care of
was
all of
just
that when they
expecting-
figured it out.
Yes, yes.
And there's Travis.
Okay,
Everybody.
so our Water Quality Advisory Council update. Okay.
Anna, this is Ellen. We're just finishing up Water Quality District. Also on the line with you is our new board member, James Stevens. So you're both with us electronically, but we're not into your item. We'll be there in a minute.
So, hi everybody, I'm Travis Ross, Missoula Valley Water Quality District, and the Water Quality Advisory Council met on January 9th. At this meeting, we had representative from the city stormwater utility, which is newly formed, to address the municipal separate storm sewer system requirements by DEQ to monitor and improve stormwater quality within the city, urbanized area. The county also has a program, but this is focused on the city. So one of the things that the city's been working on is a rate study to kind of figure out, and a capital improvement plan to figure out what needs to be done to improve stormwater. As you may remember, about a year ago, this board supported and provided $20,000 in funding to improve stormwater at Caris Park. And that this was a hydrodynamic separator to remove solids and floatables from stormwater. So that actually went in with money also from the stormwater utility about a month or two ago. So that's in line and working. Along with the stormwater utility, we'll be applying for funding to do phase 2 of that grant, which is to infiltrate stormwater and remove the discharge for most of the year from that pipe that ends at Brennan's Wave. So a lot of public exposure there. The stormwater utility is also charged with managing the levees throughout the city. That's part of their operations. So they'll be looking at that. There was some concern with members of the council of vegetation removal that will likely take place on those levees. But that is not out for any comment at this point. Let's see, what else? We next meeting, we'll be talking about Smurfit Stone, looking at PCB removal that's taking place and maybe the berm investigation study that's upcoming. The advisory council wrote a letter of support for that phase 2 stormwater grant. That's due at the end of the month for doing some of the preliminary engineering work. That is about it. We're recruiting new members right now, so that's open through the end of January. There'll be a number of reappointments and some new folks as well.
So are those levees along the river, those managed by the Corps of Engineers, or do you have to report to the Corps of Engineers?
Yeah, they're certified by the Corps of Engineers, and so the city is responsible for maintaining them, though.
Right.
I believe.
Because
there's a
we have
county
some of
one,
those
too. Yeah.
too, the Orchard Homes ones. Because one thing people don't realize with the vegetation, yeah, it seems like nice to have a little tree growing there, but if the tree tips over, it puts a hole in the levee. So that's, I mean, part of it is just going to be requirements by the Corps.
Yep. Yeah, and that's it's always hard to see, but yeah, it is, and it's hard to inspect them when you can't see them. There is some data out that the trees actually provide some roughness coefficient that's going to slow the water down, but core requirements are core requirements. Yeah.
Especially for big trees.
Mhm.
Yeah.
Anything else? Okay.
Thanks. Thank you.
you.